Wilson, colleagues, and indeed members of the media. Thank you for joining us here in Somerset as we mark an important moment for our community and our country. The restoration of the Mangrove Bay Clinic is more than just a construction project. It's a sign of progress, a return of service, and a reaffirmation that your government is listening, acting, and delivering for the people. From the outset, it's important to note that this project is possible because of the increase in the government's capital budget. This increase allows us to do more repairs, more upgrades, and more investments that have a real and lasting impact on the daily lives of Bermudians. The restoration of this clinic is a clear example of how increased investment can translate into better services and stronger communities. As someone with deep Somerset family roots, I know firsthand how important this clinic was to the people of the West and how its closure in 2017 left a real gap in access to care, one that was deeply felt by many families. So reopening this facility isn't just about bricks and mortar. It's about restoring something vital to the health and dignity of this community. The work now underway is comprehensive and is scheduled to be completed by May of 2026. We've engaged Sunrise Construction, a majority Bermudian-owned firm, to lead the restoration. They are performing structural repairs and waterproofing, installing modern HVAC, plumbing, electrical, and fire systems, and giving the clinic a full interior rebuild. The clinic will also feature new finishes and updated medical and dental equipment with a layout designed to meet the standards of care for today's patients, meet the care that today's patients expect and deserve. We're also ensuring that every dollar spent here goes back into our local economy. All subcontractors and vendors involved are Bermuda-based. Even the dental suite was sourced with both quality and value in mind. You see, this isn't just a smart capital project. It's an investment in Bermudian workers, businesses, and talent. And so I want to be clear. The decision to renovate this government-owned asset was not taken lightly. We've looked at several alternatives, including leasing and retrofitting privately owned buildings, but those options came with higher costs and more complications. And so in the end, restoring this facility made the most sense, and it gives us the flexibility to meet the needs of the community now while planning for the future. While the new community is still several years away, this clinic fills the gap in the interim. It provides a practical and forward-looking solution that restores access to essential services today while supporting the broader health reform goals of tomorrow. And while I will leave it to the Minister of Health to speak more about the services that will be provided here, I want to underscore that this clinic's reopening is a tangible example of this government's commitment to building a stronger healthcare system from the ground up. This work is not happening in isolation. Across Bermuda, this government is moving forward with a renewed sense of purpose. In the West alone, we've recently completed repairs to the structural wall at Scour Hill. We've repaved roads through Sandys and Southampton. We've done essential maintenance on Watford Bridge and will soon apply a protective coat of paint to ensure its longevity. These are not headlines, they're real improvements that affect your daily life. So to the people of Somerset, this clinic represents a promise made and a promise kept. And to the people of Bermuda, it's one of many steps your government is taking to prepare our island for the future. You see, better days are not just possible, they are already underway. Thank you.
Good afternoon, everyone. In 2023, I announced that $700,000 in capital funding had been allocated for the renovation of the Mangrove Bay Clinic, covering the building permits, construction drawings, and equipment purchase. So today, I am overjoyed and pleased to stand before you as we break ground on this long-awaited project. This clinic represents more than just a new building. It is a commitment to accessible, high-quality health care for the people of the West End. And just as residents in the East End have a local clinic, West End residents deserve the same level of care close to home. Preparation began in 2023-2024, paving the way for construction to commence in early 24-25, following the official permitting and contractor selection process. Once complete, this facility will offer essential health services, including oral health services, well baby visits, including child immunizations and developmental checks, physical therapy, occupational therapy, and speech-language pathology, sexual and reproductive health services, adult wellness clinics, and integrated mental health services in partnership with MWI. For far too long, West End residents have had to travel outside their community for these critical services, and that changes now. This clinic will be a cornerstone of community wellness, ensuring that those in Somerset and the surrounding areas have reliable health care right where they live. Medical clinics play a crucial role in the community by making quality health care accessible to those who may face financial or geographical barriers. By offering free and subsidized essential services close to home, these clinics help those erase financial burdens, reduce travel difficulties, and improve overall well-being. Their presence not only strengthens public health, but also fosters a sense of support and care, ensuring health care is within reach for all. I've been pushing for this initiative for quite some time because I know firsthand the value it will bring to our community, not just in terms of improving healthcare access, but in strengthening the very fabric of our neighborhoods. As the Minister of Health and one of the area MPs, this project is near and dear to my heart. More than that, this is my home. I live here, I walk these streets, and I hear directly from residents about how much they look forward to the clinic's return and the impact this clinic will have on their daily lives. We all appreciate the need for a clinic in this area, and today I'm very happy that we are bringing this vision to life. Let's celebrate this milestone and look forward to a healthier future for Bermuda as we strive for healthy people in healthy communities. Thank you.
Thank you, Ministers, for your updates. Right now, we're going to take a few questions from the Royal Gazette.
Thank you, Mr. Adams and Ms. Wilson. Just a clarification. This facility was closed down in 2017. And that was the year that the PLP returned to government. So I was wondering which government authorized, whose administration did the closure happen under?
We were actually just thinking about that. I do recall when I first became appointed as the Minister of Health in 2017 that there were some challenges with respect to this facility. There was a leaking roof, which unfortunately required repairs to the damage, and then there was quite a lot of mold infestation as a result of the leaky roof. So it did require substantive renovations to repair it and get it ready for a health facility deserving of the West Enders.
So it was closed under the PLP's authority?
Again, I don't know the exact date, but I do recall that in 2017, when I became the minister, there was an issue here as it related to the structural integrity of the building, and the roof was leaking, which as a result of that increased mold infestation.
Is that part of the reason why it was vacant for so long before construction began and contractors were sought?
That is part of the reason, and you'll recall in my statement I spoke about in 2022-23, there was money that was allocated with respect to the clinics in the West End. So we did utilize some of that money for rendering drawings and the like. However, also at the same time, we did see issues as it related to asbestos in the roof at Leafroy, and that's obviously an area that houses vulnerable populations, so we had to afford some of the monies and transfer it there so that we could repair the roof for the residents at the Leafroy facility.
Will there be any additions to this clinic that were not in the previous one that closed down?
I can yield to the minister, but the area that we're standing in right now, this brick area, will be covered and it will become the reception area for the clients that visit this clinic. Did you have more to add?
Nothing more to add. Yes, the minister's correct.
What message do you have for, you talked a little bit about this, but do you guys have, what message
behind us to open up a facility so that the West End residents have access to essential healthcare needs so that we can ensure that we have healthy people and healthy communities.
And if I could just add, what I mentioned in my statement was some of the things that this government has done in the Western End recently, whether it be the repaving of our road, the fixing of Scour Hill, and the like. And so ultimately what we're trying to demonstrate is that progress is being made and progress will continue.
Thank you, ministers, for your briefings. That concludes the remarks portion. Right now, we'll observe the ministers proceed to the symbolic groundbreaking.
We're good.
Okay.
Awesome.
Thank you.